Hi there. Welcome to the Made to Mom podcast. I'm your host, Dr. Alexia Priolo, naturopathic doctor. And on today's episode, I'll be discussing one of my least favorite pregnancy symptoms, nausea and vomiting. So, 70% of people experience nausea and vomiting in pregnancy. It's sometimes referred to as morning sickness, but actually, only about 1.8% of women experience nausea and vomiting in the morning, while 80% of people report all day nausea. No fun. For me personally, while I luckily never vomited, my nausea was very much present at night. Oftentimes, I would wake up to just feeling like, oh my gosh, like I'm so nauseous. Now, while the exact cause of nausea and vomiting isn't well understood, it's believed to be caused by a combination of factors. Women who are less than 20 years old and first pregnancies. Nausea and vomiting usually begins around the 6th to 8th week of pregnancy and typically subsides between 16 to 20 weeks, but sometimes it continues all the way until the end of pregnancy. So, it isn't just an annoyance. Nausea and vomiting can have a significant impact on somebody's quality of life, including their social, emotional, and physiological health. In addition, it can also impact their work. 47% of working women feel like their job efficiency is reduced, 35% lose work time, and 25% lose time from housework. Now, you might have heard of hyperemesis gravidarum, which is a severe form of nausea and vomiting in pregnancy, which affects between zero point 0.3 to 3.6% of pregnant women. Now, to be diagnosed with hyperemesis gravidarum, you may have severe nausea or vomiting prior to 16 weeks gestation, an inability to eat or drink normally, a huge negative impact on your daily activities, and maybe also dehydration. Risk factors for hyperemesis gravidarum include pregnancy at a young age, pregnancy with a female fetus, a multiples pregnancy, a molar pregnancy, and a pregnancy where there's underlying medical conditions. This might be a thyroid or parathyroid dysfunction. It may be hypercholesterolemia or even type 1 diabetes, among some examples. And lastly, the last risk factor is a history of hyperemesis gravidarum in a previous pregnancy. Now, hyperemesis gravidarum has both short and long term outcomes on a person. In the short term, there may be weight loss from not consuming enough calories, dehydration, an electrolyte balance, Wernicke encephalopathy, vitamin K deficiency, depression, anxiety, and or PTSD. There may also be suicidal ideation and the consideration of terminating a pregnancy because of the severity of the symptoms. Long term outcomes of hyperemesis gravidarum include changes to family planning and depression, anxiety, and or PTSD. Now, to determine the severity of nausea and vomiting in pregnancy, you might be asked three questions by your healthcare provider. The first is on an average day, for how long do you feel nauseated or sick to your stomach? The second, on an average in a day, how many times do you vomit or throw up? And then on the third question is on an average day, how many times do you have retching or dry heaving without bringing anything up? Now, based on this score, a person would be categorized into mild, moderate, or severe nausea and vomiting. In somebody who had mild nausea and vomiting in pregnancy, their symptoms may be managed through dietary and lifestyle changes. A moderate score may be managed by complementary and pharmacological treatments, while a severe score may be managed or may be indicative of hyperemesis gravidarum and managed by pharmacological treatments and nutritional supplementation via IV therapy. Now, unfortunately, there isn't much information about how effective dietary changes are, at preventing or treating nausea and vomiting during pregnancy. In general, though, guidelines suggest that women should be counseled to eat whatever pregnancy safe foods appeal to them, including frequent small meals every 1 to 2 hours to avoid a full stomach, avoiding spicy or fatty foods, eliminating supplemental iron, and we'll talk about that in just a sec, eating bland or dry foods, and then eating high protein snacks and crackers in the morning before getting out of bed. And so this is that classic, like, keep a pack of crackers on your nightstand. From a personal perspective, I feel that once you get through or as you're going through nausea and vomiting, you'll kind of like find out what works for you. So, like, in my case, I remember finishing clinic at like 8 o'clock at night, and then needing to have a snack on the way to the car. And then I would get some nausea in the morning, but for me, like, always having something, always keeping full essentially and never being super hungry, like that kind of helped manage things. And ginger chews and pericardium 6, which I'll talk about in a little bit. So first, let's rewind and talk about that iron piece. Now, some people experience nausea and vomiting because of the iron in their prenatal vitamin. Now, if this happens to be the case and you're able to kind of really suss out that, okay, this is the iron that's making things worse, then you should speak to your care provider about discontinuing the iron containing prenatal vitamins and substituting it with a simple folic acid until the nausea and vomiting subside. In the case of an iron deficiency, we'll discuss that in a future podcast episode. But if you're iron deficient, as most people are, you really can avoid it throughout the entirety of your pregnancy. And we'll chat in an upcoming episode about like why being iron deficient can cause like adverse pregnancy outcomes. Now, in terms of pharmaceuticals, the common treatment for nausea and vomiting in pregnancy is a combination of an antihistamine and vitamin B6. Now, this is a safe combination in pregnancy, but it's not an acute treatment. So, what that means is you can't just take one pill when you're feeling nauseous and then stop and then maybe take it again in 2 days and then stop and do that. I've had some clients do that, and it kind of just defeats the purpose of what this medication does. It needs to be taken on a regular occurrence to reduce the severity of nausea and vomiting in pregnancy. Now, once the nausea has decreased, as it should, rather than stopping it all at once, a lot of OBs or family doctors or midwives, like these healthcare providers, the person who prescribed this medication may have you taper off. And so I've had some clients where they were successfully able to taper off the medication, but I've had some that kind of continue all the way up until they give birth. So let's chat about evidence based complementary therapies that have also been shown to be helpful. Now, ginger has been traditionally used to help address gastrointestinal issues, and because it's safe in pregnancy, it has the potential to alleviate symptoms of nausea and vomiting in pregnant people. It's more effective at placebo at reducing the severity of nausea, but it doesn't always significantly reduce the vomiting episodes. And studies show that ginger is just as effective as vitamin B6. Now, vitamin B6 is a water soluble vitamin and it's widely used for nausea and vomiting. As I had mentioned, it's a common ingredient found in that pharmaceutical for nausea and vomiting in pregnancy. Now, research shows that vitamin B6 used alone for nausea and vomiting helps to improve the symptoms of nausea, but it is important to be aware of how much vitamin B6 you're taking, though, as the upper limit of vitamin B6 consumption in pregnancy is 200 milligrams per day. So, you want to speak to your obstetrical care provider or naturopathic doctor to determine if this treatment is appropriate to you. And this kind of goes back to the first episode where I discussed, going through supplements that you might have been taking prior to pregnancy and, should you be taking them while you're pregnant? Because sometimes if someone is taking like an adaptogen or an iron supplement and a B complex, like a lot of these all have like vitamin B6 in it. And so we just don't want to put you above that upper limit. Okay. The last evidence-based complementary therapy is my favorite is acupuncture and acupressure. So if you're not familiar with acupuncture, it's stimulating specific acupoints in the body with a needle that triggers a series of responses in the body helping to reduce nausea and vomiting. Now, first it sends the signals to the vomiting center in the brain through nerve pathways in the body, which helps to control abnormal stomach reactions. Then the acupuncture stimulates different nerve pathways that can either speed up or slow down the movement of the digestive system, helping to ease the symptoms. Acupuncture can also regulate the release of certain substances in the body that are linked to vomiting, as well as balance the activity of different parts of the nervous system to reduce these symptoms. One study showed that a combination of acupuncture and the pharmaceutical use, so that common pharmaceutical used in nausea and vomiting in pregnancy, led to a decrease in nausea and vomiting compared to the medication alone. Now, acupressure is a branch of acupuncture, with the difference being that it doesn't require needles to stimulate the points. Instead, it's a manual stimulation of acupoints using fingers, press seeds, or C-bands. The acupoint pericardium 6 is a point that helps to relieve nausea and has been studied for nausea and vomiting in pregnancy. Applying pressure to the specific point about 4 times a day for 10 minutes has been shown to relieve vomiting, retching, and nausea. Now, during my pregnancies, I found that ginger and acupressure to be quite helpful in reducing my symptoms, even if the nausea basically lasted almost midway through my pregnancy. I remember feeling nauseous at like 9 o'clock at night, jumping out of bed. I was like, oh my gosh, like, I need the toilet. But then unfortunately, my partner was taking a shower. So I was like, okay, like what can I do? And I had some acupressure seeds. So these are like dried Vicaria seeds. And I remember applying them to PC6, and this is just an N1 study. Like this is a study of just Alexia, but it it was amazing. I felt so relieved. And so now whenever someone is coming to see me in my practice, either like really early in pregnancy where they're experiencing nausea and vomiting, then I'll go home, like we'll do acupuncture, and then I'll send them home with these little acupuncture seeds. And sometimes people can also begin to experience nausea towards the end of pregnancy. And then I'll go ahead and put these seeds back on at the end of their treatment just to provide some relief, because I know that it was my least favorite symptom and it's probably theirs as well. All right. So thank you so much for listening to this episode about nausea and vomiting in pregnancy and what the difference is with like hyperemesis gravidarum. I hope you found it important. Now, if you've been pregnant, let me know. Like, did you experience nausea and vomiting? And is there a particular treatment that you worked best for you, or maybe something that didn't? If you found this episode helpful, please subscribe to this podcast, leave a review, or follow me on Instagram. I'll talk to you next time. Thanks for watching. Bye.